Good morning. I'm Judy Shanley. I'm the Assistant Vice President for Education and Youth Transitions at Easter Seals in Chicago, Illinois, and we are thrilled to be here among this really amazing group and have been involved in this effort for a long time. I wanted to just do three things. I'll tell you a little about myself and then our center. I'm really proud of our National Center for Mobility Management. I'd like to share a little about that with you. And then I want to relay some of the learning that we've had in our work with those 16 grantees that we've heard about this morning. Much of what I'm going to say is going to affirm what we've heard, which is really important, I think. I came to this, I worked at the U.S. Department of Education, and I worked on strategies associated with students with disabilities moving to post-school settings, whether it's college, whether it's living independently in the community, whether it's going to work. And I was always frustrated that we were talking about these amazing strategies to facilitate post-school outcomes for students, and yet no one was talking about transportation. And then when we thought about students with disabilities specifically, who many of which had a lot of medical needs and a lot of healthcare needs, we weren't talking about how that transition to post-school settings would affect their healthcare outcomes. And so that's how I became involved in the intersection of the health and transportation work, and so fortunate that I'm involved in this work and we're involved in this work. Who has heard of the National Center for Mobility Management? Yay, I love that. We are proudly funded by the Federal Transit Administration. We're a cooperative agreement and National Technical Assistance Center. And Bruce had mentioned, we don't know all the answers and we don't know all the questions. Well, as National Center, that's our charge, right? We're kind of at the beck and call of the Federal Transit Administration, but we've got our ears to the ground and our eyes to the ground and working with local communities and kind of a conduit for disseminating information. We are a partnership between three organizations, so it's Easter Seals, the Community Transportation Association of America, and the American Public Transportation Association, which is, we're modeling how the field works, right? The human services side and transportation and transit, both community transportation and large transit. So we're a model for what this work should look like at the local level. And our charge really is to build community capacity to implement mobility management strategies or coordination strategies across modes of transportation, across all the various people that need transportation, including the first mile, last mile, thinking about paths of travel and walkability. So we're your central repository of information around mobility management and coordination. And we've had the fortune of being able to work with the 16 small demonstration grants that has been mentioned. We both administered the project and provided technical assistance support to those grantees. And so I just wanted to highlight some of the learnings. It's gonna affirm what we've heard, but think about what this means to you in your practice in terms of sustainability, replicability. How do we take what we've learned from these 16 communities and build on them and expand upon them? One thing loud and clear, the voices of riders at the table is critical. Some of us work on a project funded by the Administration for Community Living, which looks at how do you engage people with disabilities and older adults in coordinated planning. The voices of riders, of patients is critical. In Flint, Michigan, they have a Rides to Groceries program, really neat program where they looked at food deserts and they established, the transit agency established rides to those to bring people to nutritional foods, and they had people in the community sitting at the table advising the transit agency as to how to organize and inform and continuously improve the process. Many of our grantees had an educational component. Heidi mentioned, people don't know who to go to, whether it's a transit side, whether it's a healthcare side, and so having an educational component, you'll hear from our Missouri folks who have a kind of a navigator program where they trained a hospital professional regarding the transportation and transit services in the community. So having that educational component is really critical. Also, we recognize that data collection and building in data collection was had to be systemic, both in the design, the carrying out, the evaluation of the project. It couldn't be an afterthought. It couldn't be, oh, we're going to collect data and try to identify return on investment after the fact. That building that process in as the projects were conceptualizing and developing was really critical. Multiple measures of data collection too. At the individual level, what does it mean to me as a writer? At the organizational level, if it's a human service organization, a transit agency, and then at a systems level in a community, all those points of data collection were really critical. The technical assistance supports that the communities needed was really evident. It was multiple levels. They all came into the work at different levels and at different points of experience, and partnerships. Bruce mentioned, kind of the partnerships, and Oscar mentioned too, how do you measure the value of those partnerships? Many of them had very different relationships and familiarity with the partners who were at the table. So providing technical assistance and ongoing supports was critical. Also important was the peer-to-peer learning. The National Center for Mobility Management created opportunities for grantees to get together and share challenges and success. And I think in our work as we move forward with this, that's still a really important component. And then finally, many of our grantees started using data to inform and market, and many of them competed for this new round of Rides to Wellness grants, and it was important for them to know how to use data to both market and inform and communicate. Our folks are the grants in North Carolina and Raleigh particularly was skillful in doing that as they reached out to the regional transit authorities. So those are just some of our learning. It's not any big surprise, but think about what this means in terms of scalability and replicability, and look forward to continued dialogue about this. Thank you.